Now, COSATU in the Northwest says it's disappointed with the actions of the province's health MEC. This follows an incident at the Mahikeng Provincial Hospital where newborns were placed in cardboard boxes instead of incubators. Now, images of the babies went viral on social media. For more reaction, we joined now by Kopano Konopi, COSATU Secretary in the Northwest. Mr. Konopi, thank you so much for your time. You're saying that authorities are using workers as scapegoats. What do you mean by that?
Good morning to you and the viewers at home. It is a known fact that countrywide the health facilities are struggling with the equipment and that our country is not able to provide the necessary reliable health to the people of the province and the country in general. And it is known that the health equipment in all health facilities are a shortage. Now, we have found ourselves in a situation that in one hospital in the Northwest, there were more babies born, which were much more than the number of cribs and incubators which were available at the hospital. But instead of the authorities looking at the problem that is facing the health facilities in this, they look for an easy target, which are the workers. They target the workers, they want to suspend them, they want to put them through a disciplinary processes. But we say that it is a scapegoat for the failure of the system, and it is not the failure of the workers. The reality is that health professionals are trained to save lives and to treat the people who are ailing in the health facilities, not to leave them when they are destitute. But now we found that situation where there were more babies born and there were very little equipment that they could use to protect the lives of the babies. And the nurses in that hospital improvised so that they can keep the kids warm and be safe so that they can preserve life. But now we have seen the MEC going on to suspend and wanting to discipline many of those workers who improvised and made sure that they protect the life that was the newborn life and make sure that the parents and the mothers are able to go back home with healthy babies which are alive. And we see that it cannot be that the workers become an easy target and are used for the scapegoat for the failures of the authorities who have failed to make sure that the workers have got the necessary tools of trade and the necessary equipment that they must use in health facilities.
So are you saying you can confirm with surety that there has been disciplinary action instituted against the nurses, or that we were told that the manager or the hospital manager had been suspended at some point? What is the latest development there?
We know that there has been 2 nurses who have been suspended and others have been transferred precautionary to other facilities. And we believe that this transfer is not on the basis that they want to transfer them or whether the workers have requested this transfer. It is because it's a precautionary transfer because they want to institute a disciplinary inquiry on them. And we feel that it is not fair for workers who have made sure that the people are being serviced and they have improvised, and there is a failure of the state to provide those necessary equipment that they must be used by the workers. And it would have been unfair for the patients and the babies to not be treated and for the mothers to go home with their children.
Yes, we had the nursing union, DENOSA, earlier on the show this week, and they were saying as well that, credit needs to be given to the health providers because there's the oath that they had undertaken is to service, to protect and make sure that they do their work, albeit with limited resources. Now you're saying that the transfer of these 2 nurses can actually is tantamount to constructive dismissal because they did not apply to be transferred and it may be inconvenient or far from where they live. What is the recourse then for these workers?
The recourse for these workers is to challenge these transfers through the necessary process that is provided in terms of the Labour Relations Act. And I would say I agree with the NOSA to say that the nurses have stood by their oath that they need to serve the people and nurse them to help. And I think that there is one recourse that we will support the NOSA and all the unions in that hospital to make sure that the workers are treated fairly and no workers is being victimized for protecting life.
Yeah, you're also calling that the MEC in the Northwest should conduct an audit on the state of the health facilities. One would think that is a given, to know what assets you have, what is working, how many incubators you need on general operations. Are you saying that this has not been done?
I would say if the department was aware of what has to be done, they would have not taken the actions that they have taken now with the nurses. What we know is that there was an immediate procurement of those necessary equipment. And if the department had done that audit and they knew what assets do they have in their facilities, they would have not done the emergency procurement. And the other thing that we know is that there are a number of health facilities which have got the same challenges, and this must be done in a scientific audit where we do the necessary procurement, which must be done properly in line with the Public Finance Management Act and the procurement policies of the department. And we believe that if the department has gone about this, they would have intervened on time. They would have not used the workers as an easy target, but they would have said, they would have apologized to the people of the Northwest that because of their failure to protect the equipment, to provide the equipment, the nurses has to come in to improvise, and they would have rather congratulated the nurses that they came up with an improvisation to make sure that the patients are treated properly. And
very lastly, Mr.
Konopi,
yes, sir. Just very lastly, your views on the national health insurance as a sitting for deliberation in Parliament. Do you think that could be a solution to dealing with the public health care sector?
Yes, indeed. If you look at the funding of our health system, more than 70% of the money that we have in the country goes to private health, and it services less than 30% of the population. So if the national health insurance can come into place, it can create a balance in terms of how the funds are distributed. You should be providing more money to where more people are accessing health facilities and less money where less people are accessing health facilities. So we believe that the national health insurance will try to strike the balance so that the resource distribution in terms of the health facilities is equal and everybody can have access to good health with the facilities that are well equipped.
All right, we're going to leave it there. Thank you indeed for your time. We're speaking to Mr. Konopi. He's the COSATU secretary in the Northwest, reacting to what he says authorities using nurses as a scapegoat.